My name's Dr. Kerry Chant and I'm the Chief Health Officer for New South Wales. We are currently monitoring a respiratory illness outbreak caused by a novel coronavirus first reported in Wuhan, China in December last year. The situation is evolving rapidly overseas and we're keeping a close eye on it from an Australian perspective. People in New South Wales can be reassured our focus is on containing the spread of the virus. We are taking a precautionary approach in New South Wales and working with our other states, territories and the Commonwealth to inform our response. Outbreaks of the novel coronavirus infection among people is always a public health concern. However, the situation in Australia is different. At this time, we have a small number of cases and no evidence of transmission in the community. We are hearing reports about discrimination against people of Asian appearance, and this is causing a great distress to individuals and communities. There is no reason to avoid anyone of any background or appearance. There is no reason to avoid shopping centres in areas with strong concentrations of people with Chinese background. There is no reason to avoid certain businesses or cultural events. There is a lot of misinformation in the community, and I want to take this moment to give you the facts. Coronavirus is spread through contact with an infected person, such as through coughing or sneezing or contaminated hands. It generally occurs between people who are in close contact with one another, like for instance in a family. You cannot catch it from food, mail or packages imported from China. It actually doesn't last very long on surfaces. Masks are not recommended for people in the community. We recommend that masks are worn for people that have symptoms. The best way to protect yourself and others from respiratory viruses such as influenza is to practice good hand hygiene, clean your hands regularly, cover your nose and mouth when coughing or sneezing, avoid close contact with anyone with cold or flu-like symptoms, and for you yourself to stay at home if you're sick. These measures that prevent the transmission of influenza apply to the prevention of novel coronavirus infection as well. Personally, I have no issue walking around any areas or visiting businesses and events, and neither should you. The Australian Chinese community in New South Wales is acting swiftly and strongly to help us in our response to the containing the spread of this virus. They are supporting people in isolation and reaching out to us for information to share with their communities. And above all else, they deserve our support and appreciation in return. Racism has no place in New South Wales. And I encourage all of you to find the facts. Visit the New South Wales Health website or follow us on our Facebook and Twitter and Weibo pages to get regular updates.